No matter how it is consumed, tobacco is hazardous to your health. Whether it is in the form of cigarettes, cigars, or smokeless, there is no safe method of tobacco use. Tobacco products contain many dangerous substances, which is why it should be illegal. Hi, my name is Katherine Carpenter. At this time, I would like to preview the following topics that will be covered in this presentation, which are the health impacts of secondhand smoke, hazards for people who smoke, and the heavy burden smoking places on our healthcare industry. The first topic I will discuss is the consequences of secondhand smoke. There are many adverse health effects of secondhand smoke. Secondhand smoke contains around 7,000 chemicals, of which at least 70 have been known to cause cancer. Think about that. In 2014, Jack Roth, a professor of thoracic and cardiovascular surgery at the University of Texas, notes that secondhand smoke contains the same chemicals as active smoking. This means that non-smokers who are in the same vicinity of those who are smoke is subjected to the same health consequences, which is unfair. A 2009 book published by the Institute of Medicine indicates that since 1964, more than 2.5 million people who are non-smokers have died because of secondhand smoke exposure. Think about that. Furthermore, secondhand smoke is equivalent to active smoking in terms of the risk factors for heart disease. There is little to no difference between active smokers and non-smokers that are regularly exposed to tobacco use. According to the Center for Disease Control and Prevention, there is no risk-free level of exposure to secondhand smoke. The next topic I will discuss are health hazards for people who smoke. There are many hazards associated with people that smoke, whether it comes from the form of cigarettes or smokeless tobacco. The statistics identify that health implications of smoking are not difficult to come by. In 2017, the Center of Disease Control and Prevention published a report that demonstrates just how damaging smoking is in our society. According to the report, the number of deaths that are caused by smoking exceeds the amount of deaths caused by illegal drugs, alcohol consumption, HIV, and auto accidents combined. I would like to turn your attention to this visual aid, which indicates a smoker's lung and someone who has healthy lungs. Well, someone who has healthy lungs tend to normally be light pink, which obviously they have a longer lifespan and it's lower risk for diseases. With smoker lungs, they tend to be dark and molted, and which indicates damaged cells. Over time, smokers can develop symptoms such as shortness of breath, wheezing, and eventually lung cancer. Additionally, smokeless tobacco, also referred to as chewing tobacco, has been known to cause various forms of cancer as well. It has been known to cause tooth loss, gum disease, oral, pancreatic, and esophageal cancer in consumers. The next visual aid that I want you to take a look at is how smoking can affect our oral health. The visual aid focuses on smokeless tobacco, which displays some of the potential consequences. Here you see that someone has oral cancer, and normally you tend to have periodontal disease when you're smoking, or when you use smokeless tobacco. You have tooth loss and tooth decay. In addition to the physical health consequences of tobacco use, there are also biological and psychological consequences as well. In 2004, Robert West, a professor of health psychology and the director of tobacco studies of psychology, psychiatry, and pharmaceutical sciences of the University of Pittsburgh, wrote a book that documents smoking in terms of its addictive properties. The book indicates that smoking addiction can be thought of as the same terms as drug addiction because of how it affects the body. In the same way that drug addicts experience cravings and withdrawal symptoms, smokers are subjected to the same thing. Smokers suffer from a mechanism known as nicotine hunger when they have consumed tobacco after a certain amount of time. Aside from the physical and psychological consequences of smoking, there are many monetary impacts as well. From a governmental perspective, the costs associated with providing treatment for smoking-related illnesses are enormous. Frank Sloan, a professor of health policy and management of Duke University, wrote a book entitled The Price of Smoking that highlights the financial burden smoking places on our healthcare industry. From 1962 to 2002, more than 160 studies have been conducted on the financial burdens of smoking on the healthcare industry. Of these studies, more than 2/3 of them have been conducted in the United States. As a result of these studies, it has been identified that the annual medical expenditures in the United States range from $35.3 billion to $72.8 billion, which corresponds to roughly 3.1 to 12.6 of all personal healthcare expenses. In conclusion, let me summarize. Tobacco should be banned for many reasons. Tobacco use, to include both cigarettes and smokeless products, should be illegal because of how it affects people due to secondhand smoke, its health impacts on the user, which include both physical and psychological, and the heavy financial strain it places on our healthcare industry. I hope that this presentation that you have seen how damaging smoking use is to our society. It is the number one most preventable cause of death in the United States.